You think it is just bad clamps. You are told it's normal. You pop painkillers and push through your day. But what if that pain is your body whispering about something bigger? Today, we are talking about fibroids, something up to 80% of women will face, but almost no one talks about it. This could change how you see your body and possibly save your health. Welcome to Wellness Health Services Health Talks. I'm Dr. Joshua Derito, a family physician. I have interest in public health and cancer prevention and treatment. What are fibroids? Fibroids are non-cancerous growths of the uterus that develop in or around the uterine wall, also called leiomyomas in medical terms, and they can be as small as a seed or as big as a melon. So depending, there are various sizes, and symptoms will also depend on the size of the fibroid. They can grow in response to hormones like estrogen and progesterone. And when they are benign, their impact can be anything but harmless. So the various types of fibroids include the intramural. These grow within the uterine wall. Then we have the submucosal. They push into the uterine cavity and they often affect fertility. Then we have the subcallosal. This one grow outside of the uterus, the outer covering of the uterus, and then we also have the pedunculated ones. These are attached with a stalk to the uterus. So up to 80% of women will develop fibroids by the age of 50. More common in women between the ages of 30 to 50 years. Black women are 2 to 3 times more likely to develop fibroids and at younger ages than the rest of the races. Many women have no symptoms, but others suffer in silence. So for some, fibroids are quiet passengers. They present no symptoms, no change in periods, no pain associated with them. They are just there. For others, they hijack daily life with pain, bleeding, and even fear. What are some of the common symptoms of fibroids? A heavy or prolonged periods, cramps that worsen over time. We have fatigue from anemia, and then we have bloating or abdominal fullness. Some of the advanced complications of fibroids include anemia from heavy bleeding. We have fertility challenges or miscarriage, especially if the fibroids are submucosal. Then we have pelvic pain or pressure because of the weight, if the fibroids are big. Then we have frequent micturition or constipation from pressure or blood or bile pressure. Then we have emotional toll from chronic pain, shame, and even frustration. So how do we make a diagnosis of fibroids? One is pelvic exam to check for an enlarged uterus. When you examine a lady, you can be tell whether there's an enlargement from the pelvis, from the abdominal exam. Then ultrasound, which can be done either transabdominally or transvaginally. They help diagnose fibroids. Then we have MRI for detailed imaging for size, location, and even number. Then we have talked about hysteroscopy for direct visualization of submucosal growth. So you just desire more than guesswork. So if you are dealing with pain, bleeding, or fatigue, ask for the right test and discuss with your doctor for the possibility of fibroids. So what are the treatment options for fibroids? The treatment depends on the size, location, and also the fertility goals. There are non-surgical options like hormonal therapy. We also have use of birth control, iron supplementation for anemia. We have tranexamic to control the bleeding, and then we have vitamin D, which might reduce fibroid growth. Then we have uterine fibroid embolization, the surgical approaches, which blocks blood supply to the uterus and it stops the fibroid from growing. And then you also myomectomy, which is the removal of the fibroids, preserving the uterus, especially for ladies who deserve fertility. Then you have hysterectomy, which is the total removal of the uterus, which cures the problem completely. What are some of the risk factors that predispose ladies to getting fibroids? Women aged between 30 to 50 years, Black women have earlier onset of fibroids and more severe symptoms, a family history of fibroids, early onset of menstruation, obesity, low vitamin D levels, a high meat diet, and low intake of fruits and vegetables. So knowing what is your risk means knowing when to act. Don't wait for it to get worse. So why does early awareness matter? The earlier you catch fibroids, the more options you have. Smaller fibroids are easier to treat, fertility can be protected, and the quality of life doesn't have to suffer in silence. So too many women, especially Black women, suffer without diagnosis, without care, and without choice. That needs to change. So if your periods are changing, if your energy is gone, if your pain is dismissed, don't wait. Speak up. Track your cycles. Have a pelvic ultrasound done. Know your family history. Talk to your healthcare provider today and not tomorrow. Get to know what is your risk of having fibroids. You deserve answers. You deserve care. You deserve to feel whole again. Thank you for watching, and I encourage you to subscribe to the Overall Health YouTube channel for more tips on keeping healthy. Thank you for watching.